Oklahoma Standing Strong, a Channel 8 Town Hall. Presented commercial-free by the Oklahoma Tobacco Settlement Endowment Trust.
Hi, everyone, and thank you for joining us tonight. I'm Mark Bradshaw. We're calling this a live town hall because we're focusing tonight on your questions. And we're joined by two people with answers, Tulsa Mayor G.T. Bynum and Dr. Bruce Dart, head of Tulsa's health department. You've seen a lot of them recently. Together, they're setting the course for how we deal with the coronavirus over the coming days, weeks, and maybe months. My co-anchor, Neely Jones, is working from home tonight. She'll be bringing us some of your questions. First, let's begin with the latest COVID-19 numbers. Here's Channel 8's Aaron Christie.
As it stands now, Tulsa County is number 2 when it comes to coronavirus cases statewide. We're still trailing the Oklahoma City area, but Tulsa's numbers are steady and grim. That was true again today. 2 more COVID-19 deaths here for a total of 5 and 151 positives across Tulsa County. Statewide, Oklahoma now has 879 positive cases that we know of.
Basically, this comes down to personal responsibility.
Best case scenario, the health department says 1 in 8 people in Tulsa County will be infected with COVID-19 in the next 3 months. Worst case, half of the entire county will get it. If we're going to slow the spread, the governor says we need much more information.
Increased testing is going to help us with isolation. It's going to help us with the transmission. And so that's why the message is, hey, we have got to increase the testing across the state.
Today, Governor Stitt declared a statewide health emergency, giving health leaders more power and coordinating county and state efforts to deal with the outbreak. But lawmakers will have to approve it. He's ordered them back to the Capitol on Monday for a special session to do just that.
So we are making the right decisions based on the data in Oklahoma, and that's the message to Oklahomans. This is very serious, and for the next 3 weeks, it's critical that we continue with our social distancing.
Aaron Christie, Tulsa's Channel 8.
These two gentlemen are dialed into these numbers every day. Overnight, we've had 2 more deaths here in Tulsa County. That's in spite of staying at home and closing businesses. First of all, let me say to both of you, thank you for your leadership and hard work keeping us informed. My question to you, Mayor Bynum, is what we're doing working? Is it enough?
Well, that's a great question. And I think the key thing for folks to understand is what we're doing right now is going to impact the ability of this virus to spread moving forward. And we won't really know the impact of it for a week, 2 weeks, even 4 and 6 weeks out, because people who get the virus, typically the symptoms don't show up for between 5 and 13 days after they get it. And so you don't really have a good feel initially of the impact it's going to have. And then the governor, in the story you just ran, he's exactly right. We can't know the true spread of this virus until we get better testing in Oklahoma. It's one of the things that's driven us to be very aggressive locally, is the recognition that we can't wait for testing to arrive in our state and realize how far this is spread. We have to act proactively to slow the spread of this virus so that our healthcare system can handle it.
All right, so it's going to take some time. Dr. Dart, we also heard from the governor. He shared some of his thoughts about where we are. Is it a problem that Oklahoma has been slow to have one standard for the entire state?
You know, I think it's hard for us in Tulsa to talk about the state as a whole. I mean, we all know that there's no treatment for this disease. There's no vaccine. So the things that we can do, such as physical separation and social distancing, are really the best tools that we've got. And in Tulsa and our surrounding communities in Tulsa County, I think, have really stepped up to that challenge, have put recommendations and measures in place to assure that we are doing the right things that we can do to protect people, break the chain of transmission until we get vaccine and until we get treatment.
If you have a question, we're asking you to join the conversation tonight. Neely, there are several ways people can do so.
They've got 3 options, Mark. You can use Facebook, Twitter, or email. Now, we are streaming live right now on Facebook. You can join that conversation and comment there. You can also tweet us at KTUL News or just use the hashtag Standing Strong. And you can also email us at news@ktul.com. All right, I do have my first question tonight. Many of our viewers are asking the same basic thing, and it has to do with testing. So here's an example. I work at an essential business and dealing with the public. I worry about getting the virus and bringing it back to my family. I'm very worried, but I can't get tested. Is that fair?
All right, thank you, Neely. Let's put that question to both the mayor and Dr. Dart. Hopefully you heard that. We have a lot of people still working in places like grocery stores where they're dealing with the public. Shouldn't they get a test if they feel in danger? Let's start with you, Mayor Bynum.
Well, I mean, the candid answer is no, it's not fair. And the reality is that we're dealing with a brand new virus, that there isn't ample testing for it available. You know, that was one of the things that drove our decisions on this early on, is that this isn't something that anybody can go to their doctor's office or the drugstore and get it if they're not feeling well and see if they've got coronavirus or not. And so it's a real challenge that cities all around the world are dealing with right now. I will say, though, that this, again, is why we've put the orders that we have in place to encourage social distancing. And when you look at cities around the world that have done the things that we're doing, it has made a difference. And we've been fortunate here in Tulsa that we're able to see it happen in foreign countries, then see it happen in coastal cities. And we're earlier in the progression of the spread of this virus than those cities are. And so we were able to act earlier in that process. So that's one thing that does give me some optimism, though that's on a relative scale. We know that this is going to be bad. It is bad in every city it hits, and it's going to be bad here. But it can be less bad if people practice social distancing and slow the spread of the virus.
All right, we need some optimism. Thank you, Mayor. And Dr. Dart, before we hear from you, we've heard governors did support the idea of more testing by lifting restrictions. Here's what the governor said yesterday.
We are lifting some of the restrictions we had on who could be tested for COVID-19. Anyone with symptoms of COVID-19 or those who have come in contact with someone with COVID needs to be tested this week.
So, Dr. Dart, can we now tell those folks who are worried, go get tested for the virus?
You know, as we try very hard to ramp up our testing capacity, I think it's important to understand why you should be tested, and the governor hit on it. If you've been just being exposed, frankly, isn't enough. Because you can be tested in the incubation period and not have a positive test, so which would ultimately be a false negative. So it's important that we really pay attention to the clinical presentation, so that people, if they're sick, they should be tested. If we have known exposure, they should be tested. For example, we wouldn't test you for flu if you're not sick. And so just have the known exposure. It's important that you start to show signs and symptoms so that there's a reason to test you. And just being in the public, really, frankly, isn't a reason. We're not testing anybody who's well because there's no reason to. If you're sick, we're working very hard to ensure that you can be tested if you meet the clinical criteria for exposure, and then start showing those signs and symptoms. I think anybody who meets that criteria, no one's been turned away.
You know, a lot of us are worried about ourselves and that our families and friends will catch the virus. That's one question we received. Dr. Dart, you've said the worst case scenario, if I'm getting this right, is now about 300,000 people, worst case, or basically half of Tulsa County will get this virus. That's a sobering thought. Do you really think that's possible?
You know, it's important to our models that we're projecting, and so there's limitations to our data, and that's why we use different models to try and model a best case scenario, a worst case scenario, and then something in between. And so worst case scenario, if this continues to go unchecked, I think that's very realistic. As the mayor mentioned, the fact that we are social distancing and we're putting these guidelines in place, I think it allows us to look at our models daily and change that variable or that value that gets us to that prediction. So as we continue to look at the data, as we continue to see our number of positives go up and down, it allows us to adjust what we call an R0, or a value that tells us how many people one person can infect, which will change that ultimate number that you see in the models and the projections that we give the public.
We've seen differing opinions about when the virus will peak here in our state. Some say late April, other models point to late spring or midsummer. Governor Stitt says all those models are still too far to be very accurate. Here's the governor now.
Projecting the spread of COVID is not an exact science. We have some models and predictive analysts that are showing spikes in early April. We've seen early April. We've seen late August, and kind of everything in between. It's kind of like predicting hurricane forecasting. The farther that hurricane is out in the ocean and away from land, you have the cone of uncertainty. You've got just really, really wide.
All right, if I'm reading this right, the governor seems to be saying let's not get too wrapped up in predictions right now. Some of the gloomiest numbers may not be accurate. Mayor Bynum, do you worry people will get frustrated over these differences and just tune out?
Well, I mean, I think the governor is correct that you can look at different models, and any of those models have different variables. One of the big variables, though, for us locally is how well we do on social distancing. The goal of social distancing is not that everybody avoids the virus. No one in our city is immune to the virus, so that's an unrealistic expectation. The goal of it is to slow that spread so that our hospital system can properly treat people who need it over a longer period of time. So we actually it would be good if this peaks later on and there's a slower ramp up, because that means you're getting less immediate load on the hospital system, and our hospital system can properly help people. But I do worry about, and I know the governor does too, the economic impact of the length of this event on Tulsa and on Oklahoma and on our country. That's a very real concern. But the trade-off is people, all of a sudden having a surge in people who get it, hitting the hospital and not being able to get ventilators or ICU beds. And every model I've seen shows that if we don't do the kind of social distancing that we're encouraging here in Tulsa, that's what will happen. And that's why we've put these orders in place.
All right, I hear your message. The key point, social distancing, stay apart. Dr. Dart, this one's for you. Do you see a problem with the state not speaking in one voice on predictions as well as restrictions?
I think it's more important that in Tulsa and Tulsa County, we speak with one voice, because our responsibility is here, and we want to maintain our local focus. Now, we have partnerships with the state. We work very closely with the state, but our leadership here, our mayor of Tulsa, the mayors of our surrounding communities have really come together and have done a lot of great work to focus on protecting those citizens who live in their communities. And that's where our focus is going to maintain. And we'll continue to have those conversations with the state and continue to work with the state. But our focus is on doing what's right and what we think is best to protect citizens here in Tulsa County. And that work's going to continue.
We've had several questions this week about the mayor's stay-at-home order. It does not prevent you from leaving your house. You are still allowed to leave to go to the grocery store, attend health needs like going to the doctor's office, or pick up takeout food. You're also allowed to take a stroll, walk your dog, or ride your bike. We see a lot of that. You just can't congregate in groups, and you must observe social distancing, what the mayor says, staying at least 6 feet away from other people. But all the crowds of people filling up popular areas like the River Park trails are concerning, and it prompted this question.
My name is Tia. I'm an active runner and have recently been concerned with how many people are out despite the stay-at-home order. Do you anticipate closing some of the Tulsa trails to prevent the virus from spreading in that way?
All right, Mayor, you've been pretty adamant about people staying at home, taking the stay-at-home order seriously. Do you anticipate closing more of Tulsa parks like the river trails, or do you think Tulsans are following the social distancing guidelines?
Well, Mark, I think you did an outstanding job of summarizing those exceptions that we encourage people on as far as things that you should be leaving home for. And one of those is we don't want all of Tulsa to be, locked up in your house for months. That is not the goal here. That we would have mental health issues throughout our community if that were the case. We want people to get outside, to get exercise, to get sunshine and fresh air. The challenge we've found is in a few areas, and you highlight one of them, the River Parks trails. Other one is the trail around La Fortune Park and in the parking lot at Turkey Mountain. Those seem to be the three big ones that have come up. Our overall city parks haven't been so much of a challenge. We're really lucky here in Tulsa. We're one of the best cities in the country when it comes to the numbers of the acres of parkland per capita. So people, your average Tulsan has plenty of space to utilize in our parks, but it's in those areas that cause people to congregate. And so I had a meeting yesterday with the team from Tulsa County Parks and with River Parks, and they're putting out signage to encourage people to keep distance. They've seen from their peers in other cities that are further into this than we are that that's helped. And so, you know, as with so much on this, we're just going to take it day by day and see if that signage helps. And if it doesn't, then we'll consider other options.
All right, good advice day by day. I want to head back to Neely now with another question about the stay-at-home order. Neely.
Mark, it's something we're getting a lot of comments about. Reading this on Facebook, it comes from Lisa. She asks, when I have to go out to take my daughter to her essential job, I see there are a lot more people out there this week than there were last week. Is there more you can do to keep more people at home so this virus can slow down? Mayor Bynum, what do you say to that? Are too many businesses still open? Liquor stores, marijuana stores, car auctions?
Well, I think that, you know, we're not in the business of defining what an essential business is. That is up to the state and the governor's order that he's put in place. But one of the things that we are focusing on are what are essential for customers. And there's a difference between having a business that people go to work at and needing having customers that need to access that service. And so the answer is yes, there are a lot of things that people are still going out and doing right now that they shouldn't be. And the one sentence answer on this is if you don't need it to survive, you shouldn't be out of your house doing it. That's how critical this is for us to slow the spread of this virus in our community and save the lives of people in our city. But again, as with, you know, so many other things in this, we've never been through this before as a community. And so we're going to take it day by day and find those areas that are problematic and try to address them. I know the Tulsa Police Department has been doing a fantastic job going out and meeting with business owners and other types that have facilities that should be closed and making sure they're aware of where they fit in this overall equation. And so far, almost everyone has been very cooperative with that once they've been alerted to the order and where they fit into it.
Mayor,
but it's something that we're going to continue. You know, again, this is not something that everyone in Tulsa has done before and everybody knows what to do. And so we're going to have to iterate day by day on this and just try to get better and closer to that ideal as we move forward as a city.
Yeah, like you said, it's new to all of us. Now, here's a question you may not be able to answer. I'll ask it anyway. A few towns initiate curfews. At what point do you see that you may need to order a curfew for Tulsa?
You know, I've on all of this, you know, Dr. Dart spoke earlier about how well we're working as a community. And I would say that's not just the city of Tulsa working with his team at the Tulsa Health Department, but really all the cities in the Tulsa Metro are working together on this stuff. But the lead for guidance on this stuff is the Tulsa Health Department. So when they tell us that there's a step we need to take to help make people safer, we do that. And I visited with Dr. Dart just yesterday about this issue of a curfew. There's not necessarily a higher prevalence of people out you know, having the potential to be exposed to COVID at night versus during the daytime. And so we haven't seen a need for that to date. But as with everything else, we'll keep our options open. If the scientists and the public health experts tell us that it would be important to save lives in Tulsa, then that's certainly something we would look at. But to date, they haven't felt like that's something we have to do here.
Yeah, I've heard of one metro city that the police are pulling people over and asking them, where are you going? Have you heard that?
You know, I've heard that as an anecdote from a couple people. And it's also, there's been an urban legend fly around social media that Tulsa police are pulling people over and asking them for documentation that states they're going to an essential job. None of that is true. Now, a lot of the time when police, even pre-COVID, would pull people over, they'd ask them maybe where they're headed or whatever, just to start up a conversation. But we do not have the police manpower to be just pulling people over at random and asking them where they're going. People are free to get out and drive around town all they want. That's not a threat. The threats come when people are interacting in groups and enable that virus to spread.
Yeah, it wasn't Tulsa police doing that. It was another Tulsa County community doing that. So I just want to make that clear.
Okay.
Yeah, today Research announced it'll provide all employees a mask and gloves who want them, but those are not part of the CDC guidelines right now. Still, we've heard President Trump's advisor, Dr. Fauci, suggest all Americans wear a mask when out in public. Becky Worley shows us how we can make our own.
The conversation in public health this morning, masks or no masks?
We've asked the CDC to take another look at whether or not having more people wear masks will prevent transmission of the disease.
I think there's some rationale that we should utilize them much more than we do at the present time.
But can we do that without taxing critical stores of N95 masks needed by medical professionals?
You are not doing surgery at home or during your shopping, right? So you don't need these masks. They're harder to fit. They're less comfortable.
Jeremy Howard, a research scientist at the University of San Francisco, says the rationale for the public wearing face coverings is sound. And regardless of current guidelines, people are wearing them.
So if you want to make a mask, fine. There's just one problem. How do you find the best practices for making an effective one?
The basic pattern is not new. 2 layers of fabric, 3 folds, elastic to go around the ears. So absent guidance from the CDC, I'm going with that.
But after 2 tries, I've been able to come up with something that's usable.
You can also hand sew one. It just takes a little longer.
Ta-da!
When it comes to choosing a fabric,
there's 2 things to be aware of when it comes to picking a material. The first is breathability, and the second is, does it stop liquid?
A Cambridge University study from 2009 tested the efficiency of homemade masks and names household products like dish towels and vacuum bags as usable. And from their analysis, there are many fabric types that will work. And if sewing is totally out of the question,
we're going to fold this over.
In the it's better than nothing category, this hair tie and folded cloth option will suffice in a pinch.
And you should be okay at the store.
So, Dr. Dart, should we be wearing masks and homemade masks? Will they make any difference at all here?
You know, I love the ingenuity of people, and I think that's great and tremendous. And, you know, we've been following the CDC conversations about this very, very closely, and it looks like they will be coming out very, very soon, possibly as early as tomorrow, and changing that recommendation about the public wearing masks. Now, we know that we really want to save those N95s, those surgical masks, those healthcare masks for our healthcare community. And so I really appreciate the story about how people can protect themselves through homemade products. And it's just important that they do understand that they don't function like a product for a healthcare provider, like an N95 mask with respirators or a surgical mask, but they will help protect them. More importantly, with all the asymptomatic presentations with this disease, if somebody has this virus and isn't showing symptoms, wearing that mask will help to prevent from transmitting the virus to other people. So it's something that I believe is a great mechanism to stop the spread. I think we're going to start to see that in our society, and hopefully the CDC recommendation will be coming out very, very soon with more directive for the public and something that we can all do together.
All right, being able to go to the mall, sit down at a restaurant, even seeing your family and friends seems like a distant memory. We're all wondering when life will get back to normal, or if it ever will. Dr. Dart, what do you think about that?
You know, life will get back to normal. I think we get to decide what that normal is going to be, because I think we learned a lot, or we're learning a lot, and we're learning that how to really take care of ourselves and how to stay healthier and to take steps to ensure that our health status is the best it can be, so that when any kind of infectious disease becomes prevalent in our community, the healthier we are, the better we can adjust to it and fight this. So normal will come back to, whether it's normal it was from January, I doubt it, but I think it's going to be a better normal where Americans themselves and Tulsa County residents specifically will make better decisions to keep themselves healthier so that they can fight these kind of things when it does occur, and God forbid when that happens again, because
Mayor Bynum, when we do begin to get back to this new normal, what do you think that's going to look like?
Well, I think Dr. Dart makes a really good point that we're, as a society, developing skills right now that we haven't ever had to develop before. And I think that's going to change the way that we work, probably, and function. But I think the fundamental things about Tulsa that make it special have been in place through tornadoes and the Spanish flu and ice storms and floods and ups and downs in the oil and gas industry. And we still have a fundamental, sense of being a community that watches out for our neighbors, that contributes to our community, that helps build one another up to have rewarding lives. And in that sense, we're absolutely going to get back to normal. There's no question in my mind. All of our history points to that.
Mayor, give us an idea how difficult these decisions have been for you to make as a mayor.
They've been terrible to have to make because, I ran for this job because I saw so much potential in Tulsa, and I was so inspired by people in our community who believed that Tulsa could be better. And so many of those people were entrepreneurs that created restaurants and bars and entertainment venues here in Tulsa. And to have to put in place an order that closed those dreams of theirs down when I'd been so inspired by them and seen how hard they worked to bring it about, and to know that it was going to put thousands of people out of work, it was the worst day of my life outside of when family members have passed away. But the trade-off is far worse. The trade-off is hospitals that cannot handle the number of people that need them, that don't have ventilators for people that need them. We don't talk a lot about what it's like for people who die of this. You don't die surrounded by your family in the hospital when you have COVID-19. Your family is quarantined and you're by yourself. It's terrible. And given those choices, I felt I had to make the decisions, both with the entertainment venue restriction and later with the full shelter-in-place order, to do everything I could to protect my fellow Tulsans. When I've heard the numbers from the health department about the number of people that could get this, and when you look at just the averages here in our country, what that could mean for the number of people that could die in our city over the next couple of months, it gives you the resolve to do everything that you can to protect your neighbors. And that's why I will do that as long as I have the ability to do so as mayor. And that's why I'm asking everybody in Tulsa to do the same.
All right, Mayor, thank you. Well said. I want to take a second and remind you of the resources available to keep you informed. We have compiled all of them at KTUL.com, or pull up the links using your KTUL app. There's information like testing facilities, the latest numbers, even places to get a free meal if you need it. There's also a state hotline, and people are standing by to answer any additional questions you may have. That number is 877-215-8336. Again, that hotline is 877-215-8336. You can also call 211. I want to thank Mayor G.T. Bynum and Health Department Director Dr. Bruce Dart for joining us tonight. We appreciate you taking time out of your busy schedules to do so. Thank you so very much. And thank you at home for joining us tonight. If your question wasn't answered, we'll try to get to it as part of our daily segment, Facts Not Fear. Or maybe something came up that you want clarified. Drop us an email, news@k2l.com. Have a great night.
Oklahoma Standing Strong, a Channel 8 town hall. It is being presented commercial-free by the Oklahoma Tobacco Settlement Endowment Trust.